Well, October is Breast Cancer Awareness Month, and breast cancer is the second leading cause of death among women. Carolee McGrath sat down with Dr. Makari Judson, the chair of Baystate Health Breast Network, and Cindy Anderson, a breast cancer survivor, to learn more about this deadly disease.
You know, in reality, breast cancer awareness is something we do every day, all year. But in the month of October, in particular, in partnership with Rays of Hope, we really try to ramp up our educational efforts and get the message out there.
Now, in the last 25 years, I know that you've been involved with the Rays of Hope, since the beginning. What have you seen as changes that have come forth from all of this effort?
We've seen tremendous improvement and tremendous advancements in care. I would say some of the themes of the advances that we have made have to do with minimally invasive surgery and minimally invasive treatment, so still achieving high cure rates, but with treatments that are potentially less invasive, surgery that's less invasive, potentially shorter course radiation, potentially omitting chemotherapy in people that may not need it. Another important theme is targeted treatment. So not every breast cancer is the same. And we look at a molecular profile, we look at the profile of the biology of the cancer so that we can pick directed treatments, targeted treatments that will be the most effective. And then I think the third theme that we've seen is we're trying to identify individuals at higher risk so that we could watch them more closely.
And tell me a little bit about who would be those individuals at higher risk?
Every woman potentially is at risk for breast cancer, and women are often diagnosed with breast cancer that have no risk factors at all other than their age and being female. But in particular, we want people to be aware of their family histories. We do a lot more genetic testing now than we did 25 years ago. We want women to be aware of their breast density. So for example, women that have a mammogram with extremely dense breast tissue may be at higher lifetime risk for breast cancer. So a number of things need to be taken into account, and that helps a woman to develop a personalized plan in terms of when to start screening, how often, when to stop, but also to really look at lifestyle changes that can reduce the risk of breast cancer.
Okay, lifestyle changes like exercise, eating.
Yeah,
right.
Absolutely. So mammograms can help detect breast cancer, but mammograms don't prevent breast cancer. Healthy lifestyles do have a role. Don't smoke, limit alcohol, eat a healthful diet with plenty of fresh fruits and vegetables, and exercise regularly.
Okay, Cindy, tell us a little bit about your story, because it's sort of a unique story because you were diagnosed twice with breast cancer.
Right. First time I was diagnosed was in 1985, and I was 34 years old. And there was no Rays of Hope or Dr. Makari Judson at that time. So I did go to Dana-Farber for a second opinion only because I was confused as what to do because I had to have two visits here. One said one said lumpectomy, the other said mastectomy. And when you're 34 and you have two small children, the last thing you want to do is, I wanted to go into it with a clear mind that I was doing the right thing for me. So I went to Dana-Farber and saw all the doctors there, and they concurred that I would be best with a lumpectomy. So I felt confident in my decision. So I did that. I had a lumpectomy. I had nodes positive, so I had some of my underarm removed, which they don't do anymore. And life went on. I had to have chemotherapy, and when you have a lumpectomy, it's in conjunction with having radiation, so that's what I had done. Then 28 years later, after having no other problems, I went for my normal mammogram, and they came back and said that it was abnormal. I needed additional views, which I had done. Turned out I had breast cancer again in that same side, and I had some calcifications in the left breast, which they didn't feel was breast cancer, but it turned out to be. So I chose to I had to have a mastectomy on the side I already had work on, and I chose to have a double mastectomy at that time. But the two experiences were completely different because of what's happened in the last 33 years since my first diagnosis. And the support through Rays of Hope and the team at Baystate Breast Cancer Center is phenomenal.
And you talk about, when you say Rays of Hope and you think of that word hope, the survival rates now for women are so much better than they would have been, especially with early detection. Can you talk a little bit about that?
Absolutely. The numbers since 1990 show that a woman today has a 39% lower risk of dying from breast cancer compared to the 1990s. So that's not just from early detection, but it's from better treatments and more targeted treatments. So a woman that's diagnosed today has a 91% chance of being cancer-free at 5 years.
Okay, and I noticed that because it looks awesome, you have pink in your hair, and you participated in the Rays of Hope walk on Sunday, and I know you were there with your family. Tell me a little bit about that experience and having all of those people surrounding you.
It's an awesome experience, and if you've never even been to the walk, and you're not even a breast cancer survivor, going there can't help but inspire you. It's just such a community of loving, caring people who all have one thing in common, that they want to see a cure for breast cancer.